Hi, I'm Dr. Jennifer Scott. I am a dermatologist and dermatopathologist here at Ada West Dermatology.
And I'm Dr. Emily Boozalis. I'm a medical and cosmetic dermatologist at Ada West Dermatology. Today we're going to talk to you guys about all things Fraxel, and Dr. Scott just had the experience of getting Fraxel, so we have some kind of first-hand feedback on what that process was like for you. You want to kind of go through what your experience was like, and then we can go into the details?
Yeah. I wanted to get Fraxel because I had brown spots on the sides of my face that from sun exposure that I wanted to get rid of, and I wanted a more smooth complexion. You very kindly agreed to Fraxel my face. It was a really great experience, very easy. Numbed me up before the procedure. The procedure itself felt a little uncomfortable, but fine. And then it was about a week of healing, and then my skin has been looking glowing and smooth since.
It does look beautiful.
Thank you.
So I think a lot of patients come to us with concerns about the tone and texture of their face, sometimes brown spots, sun damage, discoloration, sometimes acne scars, scars from Mohs surgery, which is a type of skin cancer surgery on the face. And Fraxel is really great because you can adjust the settings to treat all of those skin conditions. It's pretty universally beloved by patients. Everyone has great outcomes. It was actually voted the best resurfacing laser of 2024. So yeah, it definitely works to address the concerns that Dr. Scott brought up.
Yeah, and I've been really bothered by these for a long time. Had tried like topicals and different other things, mostly topical, to help with the pigmentation, and nothing really worked quite as good as the Fraxel.
Yeah.
So I was really excited to have that done and not just keep applying different creams that didn't work.
So I first was exposed to the Fraxel laser during my residency at UCLA. It's such a versatile laser, and you really can use it to treat so many skin concerns that I really grew to love it. And what's so fun about the Fraxel is if you have a patient, for example, who's bothered by like brown discoloration on the cheeks and forehead, but then has Mohs surgical scars on the nose that bother them, you can adjust the treatment settings to target each of that patient's concerns during one treatment. So it's really fun and satisfying and artistic, and the patients love it and have all had really great outcomes. So yeah, we love the Fraxel here.
We love it.
So the Fraxel laser is very versatile because it has two different wavelengths. There's one wavelength, 1927 nanometers, which targets what's called the dermal epidermal junction, which is where a lot of the pigment lives. And Dr. Scott would know more about this because she's our amazing pathologist here. But so that setting is really good for brown discoloration, sunspots, melasma, things like that. And then there's a second wavelength on the laser, the 1550 nanometer setting, which goes deeper into kind of the superficial dermis of the skin. And that's really good at treating more fine lines, wrinkles, surgical scars, acne scars, things like that. Both settings help by building back collagen in our skin, which we all lose as we grow up. So both settings have great outcomes.
Yeah, I felt like with the 1927 laser for the pigment, I felt like I did have a little bit of like improvement of like fine lines as well.
Yes.
Which was nice. Nice surprise.
You look gorgeous. And we took her before and after glamour shots, so it's kind of fun to have those side by side too. You look at yourself in the mirror every day, so it's hard to tell day by day and see that improvement. What's really nice as a patient, when you come in for your initial cosmetic consultation, we start kind of by asking what bothers you, if you've had cosmetic treatments before, prior experience, things like that. You don't need to know these settings. You kind of just tell us what's bothering you, and we'll help fine-tune the settings to get you the best outcomes possible. The other thing I really like about Fraxel is that the improvements are immediate and progressive. So you'll see great outcomes a week after treatment, but because the Fraxel works by building collagen, you'll continue to see even more and more improvement over the course of sometimes even 3 to 6 months following your resurfacing treatment.
I feel like I've noticed that.
Yeah.
It's been probably about 6 weeks since my treatment at this point. And although like getting rid of the brown, I think was like the most obvious thing at first, I do feel like the collagen, I just feel like the fine lines and stuff keep getting better. Yeah, I noticed it most on the side of my face. That's where I had the most issues in my forehead. And then I do feel like my skin is just like ever so slightly like tighter, which is something I have noticed as I have grown up. It's less tight. And that I do think is like what is getting better.
So some patients come in and they want to treat both discoloration, like brown sun damage from sunspots, and deep wrinkles, like around their mouth, things like that. So we can do half of your treatment at one setting and half of your treatment at the other setting to address both concerns. I usually recommend for one area just using one treatment setting and then coming back and doing the complete treatment at a different setting, just because you get better results. But yeah, we can always adjust and fine-tune things.
Paired together with Fraxel.
Yeah. Today, I just beat up on a patient. I did so much. Technically, you can do Fraxel Laser resurfacing the same day as Botox or filler or any other treatment. There's no medical reason not to. I kind of just go patient by patient because I don't want you to feel like I'm beating up on you too much at one appointment. Some patients prefer to space out those treatments, but all the time we'll do multiple different treatments on the same day just fine. And I think that Fraxel has become so beloved among our patients and was voted the best resurfacing laser of this past year for so many reasons. It targets basically every skin concern that a patient can have. You can adjust the settings to correct that and treat that. The results you see within a week, so there's minimal downtime, but continue to progressively improve over the course of 3 to 6 months. And it's really safe, including in all skin types, all ages, young, old.
I feel like the results from the Fraxel are really predictable, which is nice to know as a patient. The other thing too is like I didn't actually take any time off of work after the Fraxel procedure. So, I do work in a dermatology office, so it's a little bit easier to be like, why does your face look a little funny? But honestly, most people didn't even notice there was something going on with my face, and it didn't bother me enough that I had to take time off, which is, I think, important for at least me and probably a lot of other people.
Totally, yes. Yeah, I agree. I tell my patients the last time I had Fraxel done, I went to work the next day. It looks like you got a bad sunburn, but you can tell people, oh, I had my face lasered. It's no big deal. The other thing I found is there's minimal downtime, so you really can do it whenever you want. But a lot of patients like to come in and have their Fraxel resurfacing done if they have another planned surgery, like ankle surgery, or they're taking maternity leave and they're going to have downtime anyway. It's kind of nice to have your cosmetic treatments done during that downtime, so you can just recover at home. I should say we don't recommend having elective cosmetic treatments done while you're pregnant. So wait until you're on maternity leave, and then we will help a mama out. I consider the Fraxel laser to be more of a weekend laser. So there are some things like chemical peels where patients can even come in during their lunch break and have a chemical peel done during their lunch break and go back to work. Fraxel is more of something where you expect 4 to 7 days of looking sunburned, puffy, potentially having skin peeling depending on the settings that you use. So we call it a weekend laser, although you can go right back to work the next day.
But I wouldn't want like an event during that recovery time. Like I don't need photos being taken during that time.
Don't do Fraxel the day before your daughter's wedding.
Yeah.
And then there's, on the other end of that spectrum, things like the fully ablative CO2 laser, which denudes, takes off the top layer of your skin, and that's kind of more of a weeks of healing time when you're indoors with the blinds shut, no sunlight whatsoever, and you're actually doing wound care on your skin. So that's kind of the other end of that spectrum.
Yeah, I would say the Fraxel, it's very easy to take care of your skin. Just use gentle washes and moisturizers, really good sunscreen, and that's all you really need. And you can like go out to the grocery store or whatever you have to do during that healing time, so it's not as interruptive to your life.
Disruptive to your
life. Disruptive is the word I was thinking. Oh dear.
Yeah, we're doing great.
What products did you use?
Okay. So I personally, I didn't change like my skincare routine too much after the Fraxel. I used a lot of Vaseline, which is actually something I'm pretty commonly putting on my skin because it's so dry to get wet. So it is something I already use. I know some people don't like Vaseline. But I did that, and I had a really good like zinc oxide based sunscreen that did have some tint in it to help kind of tone down that redness, so I didn't look so like red afterwards. And then I used like a CeraVe healing, or the CeraVe the nighttime, like a thick cream, and that felt really nice after the laser.
Yeah.
But no active ingredients or anything.
Yeah, I would say the most important thing as you heal from the Fraxel laser is sun protection, and that's to give you the best outcomes possible and to protect your investment. So it helps the effects of the laser last even longer if you're really diligent with sun protection after your laser treatment. The other thing is a couple of weeks ago, a paper came out that showed that applying vitamin C serum after non-ablative Fraxel gives you even better results than just doing Fraxel alone or just applying vitamin C serum alone. So now I'm telling my Fraxel patients for aftercare that they can use vitamin C serum at night as long as it's not too irritating for their skin.
Do you have a vitamin C you like?
The one I use is CeraVe vitamin C with hyaluronic acid, but there's a lot on the market that range in prices.
Yeah. It can be very expensive.
Yes.
Yeah.
Yeah, they're all good.
I like the CeraVe one too.
Yeah, The Ordinary I think makes one as well.
Yeah.
Yeah, so a lot of people ask us about chemical peels too. They just work differently. So there's different types of chemicals that you would use on a patient's face to treat different types of conditions. So that's kind of the first question is, are you treating acne or melasma, or do you just want general skin brightening? They are generally, you see good results, but less drastic improvement as you would see with something like Fraxel, but it's also lower cost and lower downtime. So you can factor those things in too.
Yeah. And you can do like more aggressive chemical peels.
Yes.
Like I did them in residency,
Yes.
but I don't do them now. And I think one of the reasons is because to me, they're a little bit less predictable than the Fraxel. And I mean, plenty of people have a lot of experience with these and they're great. But I think you can get very similar, if not better, results with the Fraxel without as much of the drama of the chemical peel.
Very predictable results, and I really haven't seen adverse outcomes from the Fraxel yet, and I've done hundreds of treatments here.
And I think that is particularly true if darker skin tones with chemical peels. That's a lot more risky than like using the Fraxel.
Yes, 100%. One thing to keep in mind with chemical peels, the FDA just recently issued a warning to the public about the serious risk of skin injury with chemical peels, and the FDA recommended going to a board-certified doctor to have that done, which I totally agree with. And we have one here, Dr. Mark Schwindeman, who offers chemical peels to patients.
Yeah, I refer all my patients who are in that chemical peel category to him, and he always gets really great results. He has a ton of experience with chemical peels and knowing how to use them on the right patients.
Yeah.
There's a lot of information out there on social media about peels, and I think what's important to keep in mind is peels come in all sorts of different varieties, from like a very minor peel for acne up to something called a phenol peel, which is a very deep peel. So if you see a result or somebody talking about a peel on the internet, that might not necessarily be your result because it might be a different type of peel.
And the phenol peel is actually quite dangerous. It requires cardiac monitoring while you do it. I would not personally do the phenol peel, so something to bear in mind. What differentiates the care that you get at AOS Dermatology is that we have board-certified dermatologists, meaning physicians who do a lot of our cosmetic procedures, including chemical peels, botox, fillers, resurfacing lasers. So you will find physicians with really robust medical training here to treat you safely. There's a couple cosmetic treatments you can do to treat pre-cancerous spots, also called actinic keratoses. There are certain chemical peels that can help clear pre-cancerous spots, especially if you have quite a few over a broad area. And then the Fraxel 1927 setting is actually FDA approved to treat pre-cancerous spots as well, actinic keratoses. So that's an added benefit, is it would treat your pre-cancerous spots. Most patients come to me primarily because they want the Fraxel Resurfacing Laser for cosmetic concerns, just to improve overall tone and texture. But what I've found from taking before and after photos is that it's actually completely cleared their precancerous spots as well, which has been really lovely. Yeah. It was most dramatic in one of my male patients, actually, who had quite a few precancerous spots, and then in his follow-up photos, it was just like they had never been there. It was really incredible to see.
Nice. That's the added benefit for sure.
Yeah.
Yeah, I think something that like people will commonly ask me in clinic is like, what can even out my skin tone or get rid of like this or that? And I think, yes, we can do some tretinoin, which is a prescription strength retinoid. We can do Effudex if you do have precancers, and that is like the recommended treatment for precancers. I definitely recommend that. But I think if you really want to see like a dramatic result with mostly like the brown spots and the texture and the fine lines and stuff, like I think it is worth investing in a Fraxel treatment as opposed to just like keep trying the topicals, because I just think you're not going to get that result like you would if you just went ahead and just did the Fraxel straight away.
Yeah. We have some patients who just do one Fraxel treatment and they look amazing and they just need one treatment. That's usually our younger patients, like Dr. Jennifer Scott. And then we have some women who spent their whole life in the sun or used baby oil and prefer a series of treatments. And so in that case, I tell them to wait at least 4 to 6 weeks before treatment, just so they can see kind of the degree of improvement, and we can kind of adjust the settings based on how they look. In cosmetics, sometimes patients believe that beauty is pain, and so more pain gets you better outcomes. So Dr. Scott, you just went through the Fraxel.
I mean, it's not painful like enough to not do it, and it really was not that bad. Like I've had other lasers, I've had PDL on my face.
Yeah.
I thought I wasn't numbed for that, but I thought that was like maybe a little bit more painful, especially around the nose. I think I've had other things done to my face. I don't think the Fraxel is, that should be a reason not to do the Fraxel, because the pain is very tolerable.
Totally.
CO2, we have people doing CO2 here, we have people doing chemical peels here.
Yes.
And I think it's just a matter of like patient preference, what you're looking for, how much downtime you have, how much, what exact result you want. And so I think there's a spectrum of things you can do, and that's something I talk to my patients about when they ask about this. It's like kind of like, what are your goals? How much downtime do you have? If you want the CO2 laser, I think you have to be really committed to that because of the wound care and the staying out of the sun and staying away from doing anything. And so it just is very person dependent.
Yeah, and patient selection is so important too, because for the CO2 laser, there's, potentially higher reward, but also higher risk. So you have to be very careful about the patients that you select for this procedure. So really, like fair-skinned individuals tend to have a lower risk of scarring. I think kind of older patients with a lot of very deep wrinkles who are very fair-skinned are great candidates for the CO2 laser.
And I mean, I tell my patients that I don't do CO2 laser myself, but I definitely will recommend that for people who are in that group and really want those dramatic results. Yes, then CO2 is probably a good solution
totally
for
agree.
them.
With regard to like pain and Fraxel, so when I had Fraxel done, I felt like it kind of felt like warm pins and needles on your skin. I don't know if that was like your experience.
That's a good way to describe it.
But we do topical numbing, so it's very comfortable with topical numbing. If you would like, we can also offer a full face nerve block, and so there's no reason to be a hero or be uncomfortable. We can make sure that you are totally numb if you want to be totally numb.
Okay.
Who do you think noticed the results of your Fraxel?
Well, that's a good question. I think I walked in to my office area upstairs, and one of our medical assistants was like, "You're glowing today." So maybe we're the derm office.
Did your husband notice?
Well, I think so, but like he sees me every day, and he lives the life of like kind of a dermatologist, like expecting like, I don't know, me to be doing stuff to my face.
Yeah.
But yeah, of course he noticed.
So it's so funny. I feel like whenever I have cosmetics done, my husband will make these comments like, "Oh, you must have been eating well. Your skin is glowing." Like, yeah. It's just my really great diet.
That's funny.
Celebrities in Fraxel? Do you know very?
I think Madonna did Fraxel.
Oh, really?
Yeah.
I didn't know.
Gosh,
Your
I
skin looks
really
great.
don't have a lot of it. I don't know. Sorry.
I would say though, like, there's no way they're looking that good, the celebrities, without some type of resurfacing.
Let me tell you, they're doing a lot of stuff.
They're doing stuff.
When I was at UCLA, we saw a lot of celebrities that are doing a lot of things.
Yeah.
Nobody looks that good naturally.
Yeah, and they do look really natural too.
Yeah.
Like they have the best dermatologist.
Oh,
You're at UCLA.
well. We have a great team here. I mean, I think what's great about Fraxel is that it benefits all ages, genders, skin types, skin tones, skin conditions. It's so versatile. So really, anybody who wants to see improvement in their skin tone and texture would benefit from Fraxel. One metaphor I've heard, like the dirty windshield metaphor, where you're driving and your windshield's dirty for so long you don't really realize it. And then when you clean it off, you're like, wow, I can see so well through my windshield now. I didn't realize how bad it was. And I feel like Fraxel's kind of like that. Like you're looking at yourself in the mirror every day, and then you have Fraxel done and you're like, oh my gosh, I look like 5 years younger, like myself, just refreshed and rested without all this sun damage and kind of background pigment distracting from your beautiful face.
Yeah. When we got this Fraxel machine, my mom really wanted to get treated. So I was like, okay, come in and I'll treat you.
Yeah.
And she had been out in the sun a lot, grew up in Florida, a lot of like brown spots, and she's had pre-cancers. So she's like the perfect person for Fraxel. And she's now the Fraxel's biggest fan.
She's the face of Fraxel treatment.
She's basically the face of Fraxel. She had really great results with just one treatment.
Yeah.
And we are getting ready to perhaps do another one in the next 6
Yes.
months.
Bring in the moms.
But I think like for someone like her who's in their 60s and has just had that like lifetime of sun exposure, just such a great treatment. And like her skin looks so much better. And I will say she's very social with people outside of the field of dermatology, and they all have like noticed how her skin has improved. And other thing she's been really happy about is that she doesn't feel like she needs to like cover up her face with like like makeup. She just puts on her sunscreen now and goes out of the house.
If you are considering Fraxel, you can call to book a consultation with one of our amazing board-certified dermatologists here at 8OS Dermatology.
So if you're following along from outside of our immediate area, I think the most important thing you want to look for in whoever is doing your resurfacing is experience, and usually that means being a board-certified dermatologist or a plastic surgeon, because although these things are great and we have a lot of fun with them, there is significant risk with any of these procedures, and it really needs to be operated by somebody with experience and knowledge of these things.
Yeah.